I didn't know.
Oh, okay. Well, here we're live. Ta-da!
Melissa is like actively trying to not upload the intro video.
I know it's uploaded. I didn't upload it.
I don't know where the hell it is.
I'm gonna have it on today, right?
Yeah.
Everyone, this is the Health Tech Talk Show. We lied last time. We were gonna have a fancy intro video, and then of course, because we never prepare, we did not actually upload it. So it's still coming.
It's still not uploaded, but
it's gonna come.
That's okay.
But it's done. Yeah. It's done, and that's the point.
It's done, and that's the point.
It's done, and it's edited, and Michael did so many cool little things to it, and it's gonna be amazing when everyone sees it. I know
we're gonna do it for sure.
Well, if someone can figure out how to freaking upload it while we're on the show,
I'm gonna do that. If you can get me off camera,
yeah.
So I don't have the face.
Okay. This is Melissa saying she doesn't want to be on our TV show anymore.
She's gone. That's fine. She's gone.
All right. So welcome America to my new house as well, where this is my semi-permanent background and bad lighting. But Lisa's is great. So look at her instead.
Yeah. Actually, let me improve my lighting. I can do that as well.
No, your lighting is 1 million times better. Newspocalypse. Newsmageddon.
I was thinking that last week was, a big deal in the news world. And I was wrong, because this week was just truly health tech, M&A, newsmageddon.
Yeah, it's Newsmageddon. It was a lot. And so we have a Slack channel with Melissa and Leslie, and I don't actually know who else. And Lisa constantly posts news there. And honestly, Lisa posts so much news there that I don't check it all the time. And then she was like, Kat, why are you not responding to the Newsmageddon? There was a lot. There was a lot there. So we have like a really hardcore news show to show you guys. And then theoretically, Jamie Edwards is also coming on this show, but we don't know where he is right now. So he might not, in which case it's cool because we have so much news to talk about that doesn't even matter.
So much news.
Doesn't even matter. So yeah. Do we have any pre-news, Lisa?
Any pre-news?
Yeah, we were on the Joe Rogan talk show.
Oh. Yeah,
that was cool too.
The DCEKG podcast. I actually forced myself to listen to the whole thing. I talked a lot, as you might not be surprised to hear, and but I think Kat and I both sounded pretty smart. And Joe Rogan is a big deal in the Trump policy world. Is served in Trump v1 administration. Super bright. And really interesting questions. And that was quite the interview. Really exciting.
Watches our show. He watches our show. He watches our show.
Thanks, Joe. Susan, super fan of the show. Susan, whom we love, just highlighted another thing that came in today, which is the HHS AI strategic plan, which is really timely because there is, I think, 9 days left in the administration. So it's definitely time to do all that stuff. Yeah,
totally. And I haven't read it, but Mitch Cheney on the Incentive team told me she was going to read it, and maybe we'll have some details next time on that. Maybe. Maybe. We'll see. But yeah, so it was like a wild week. There was, I think, part of this is this does happen every year, right? Pre-JPM, there's a lot going on, and this was not a week of 2025 that let us down. So. Starting out, this is not deal news. This came in today. Lisa, do you want to talk about this?
Yeah, I mean, the only thing I'll say about this is the latest back and forth in the particle v epic thing we've talked about a lot. The only thing I found most hilarious is that apparently, as a friend of the show, Brendan Keeler noted, the law firm for particle, they took until midnight, until 11:59 p.m. to file this. They had whatever. Anyway, took a really long time, and they had a hilarious typo, which I imagine they've updated since then. At the end, it said epic to dismiss this case or whatever. And I was like, you guys, you gotta do your work before it's due. You gotta do it right before it's due. Seriously.
Yeah, I was kind of thinking maybe they were just pulling a stunt to be wild, but then it does seem like maybe they just did take forever. Yeah. But I mean, my argument remains here. I don't think they're doing a good job proving that this is a late to market product of anything. But you know, as I think we've seen in the point click care v RTMS case, you might just get a judge who doesn't know the industry, and our industry is freaking insane. Like at least as an example, Joe Groban, smart dude, right? Like served in the Trump administration, worked on the huge interoperability rule, like knows shit. And even he was like, is this about the info blocking rule or what is it?
It's hard.
It's a really confusing space to come in on. So yeah, you know, maybe Particle will get lucky and get a judge that doesn't know shit.
Well, I mean, again, check out Brendan's post on LinkedIn because he goes into some of the kind of questions and points. Like still, they're not making totally valid arguments about the other competitive companies in the space like Datavant, which is one of the points that we made and one of the points that Brendan has made. There are, you know, that as you've described, Kat, there are actually multiple companies who are getting data to payers. It's not a brand new thing that has never been done by anybody but Particle. Yeah.
I mean, I'm pretty sure I was doing this in like 2017. So just saying it's 2025 now. And I also, when I joined that company in 2017, we had also been doing it for a while before. So I don't know, like whatever, you know.
We'll see. We'll find out.
Blah, blah, blah.
We'll know soon.
Anyway, okay, moving on to fun news. So this was also like meme central. Like, oh my gosh, Lisa had so much fun on the Twitter, on the X, finding all the memes. So we got a lot of memes in here from people who also won awards last week in our best and worst of everything list. So to start, it turns out Lisa did research on this H1. Turns out she says it's a fake company, which is something she says fairly often. But they acquired Ribbon Health, provider directories. Yay!
No, it's a company focused on,
I don't know.
It's a company focused on clinical trials recruiting and connecting pharma companies to the right doctors across the world. And so they acquired Ribbon Health, which is just, you know, like I said, we're going to see a ton of these roll-ups, ton of these acquisitions based on rolling up components.
Yeah. So, you know what? Congratulations to anyone that it gets acquired and it's not like total trash. So congrats to Ribbon Health. Another big one. This was like, the memes were like so real on this one. We've got a few slides on this. Glenn Tolman acquired Accolade, Glenn Tolman's company, which is transparent, but everybody calls it Glenn Tolman's company, and no one knows what it actually does. So they apparently acquire distressed assets too. So that's great. Like, yeah. You know, someone was telling me the other day that like Accolade has been around for a while, and it used to be cool.
Yeah. I mean, you know, they went public, you know, during the height of the going public COVID times, as far as I understand, and they raised, you know, a fair amount of money, but I don't know if there's much to support that beyond it. I think what's interesting about this is obviously, I mean, everyone listen. When I say fake, when I say scam, I'm just being a sarcastic, mean person. These people have millions and millions and millions and millions of dollars. They are just fine. Their feelings are not going to be hurt by me, you know, saying that about them. But what I will say is that if I were an investor in one of these companies, I would be asking some questions about how the people involved are like funding and moving assets around. Because some of this feels a little bit like a shell game. I'm not saying anything specific, whatever, my opinion, like caveat, but you know, like sometimes things are a little bit more financialized than they are about actual health tech solutions.
Lisa, do you not feel great power that anyone gives a shit that you think a company sucks though?
I hope they don't. Like they shouldn't care what I have to say.
But they do. And I just want to say, like, whenever someone's like, you guys don't know what you're talking about. And
You're
like,
being mean.
Did you watch that 62-minute show with Kat and Lisa just to find out you didn't like us? Like, I am freaking here for all of that. So anyway, so this was like big news. This is like a pretty gigantic acquisition. Blake Madden, friend of the show, hospitality. This guy is good at writing stuff. You know, he kind of has a breakdown here. So yeah, they play like half of their IPO value is what they were acquired for. Bummer. Sounds like a little bit of a fire sale there. I think we got something in from the amazing Mr. H, his talk, which remains our favorite news outlet in America. We probably should have given Mr. H the best media award, but we deal so much with like politics shit that Politico won. Next year, Mr. H, you will win. But so kind of sad. And yeah, like he says, this looks like it was a fire sale. And I mean,
I think his sentence here is like what it is. Fire sale deal. There will be more of this. And there are a bunch of companies that are struggling, publicly traded companies that have run out of investor patience. Like that's basically it. This is a take private deal, and there's going to be more of these in healthcare and in health tech specifically.
Can we also just say there's some comment high-fiving going on here? It looks like Deanne and Kevin are long lost friends just meeting in the Health Tech Talk Show comments. I just want to say I'm here for all this friendship.
We're here for it.
Yeah. What do we got next? So this is the meme show. Oh my gosh, this is Nikhil. I think I might have, I think I just got the picture here, but this is Nikhil who won Best Shit Poster of 2024 by the Health Tech Talk Show last week. This was a good one from him. Next one, this is from Otto. Also, one most innovative company after the show via guest comments. If one overvalued health tech startup buys previously overvalued startup in the woods, does it make value? Like sometimes somehow money appears. I don't know if value appears, but money does appear. So
yeah.
I don't know. Obviously, I like this tweet. So this was a fun one too. Also, we recently found this guy, Sergey, and he's pretty fun. So you guys should like check him out. So Lisa, he's got a
Substack. He writes. I think not going to speak out of turn here, but I think he may be writing something interesting about my least favorite AI company of the moment. So
maybe
TBD. We'll see. Really smart guy who's been doing some interesting analysis of health AI stuff. And
yeah, we like this guy. All right, so then. Okay, there's some other more acquisitions here because again, it's pre-JPM week. This is pretty normal. A lot of companies put out their news this week. So this was confusing to me, Lisa, and you might know because don't we know Health EC? Like, don't they mush around and talk trash about a lot of HIEs or something?
I don't know for sure, but it looks plausible.
I feel like I've heard the CEO's name in like 100 rumors, trash talking CEOs of HIEs for not wanting to work with them. I don't know. I don't know. So Health EC and Virtual Health, which does something, unite in an unstated manner to form a new company. That doesn't sound like money was exchanged, but something happened here. And you know what? We're here for it. We're here for it. Love it. This is like this would be like me and Lisa making the talk show. We united in an unstated manner. Here for it. And well, this is more like kind of saddish news, right? This is all like post-pandemic fallout where everybody spent $100 bajillion on various things and then unsold them for less than $100 billion or whatever for not a lot. So sad thing here. So Amwell, as everybody knows, is their valuation. They've lost a lot of money this year. They're 99% of their all-time high in January 2021. Right after their IPO, so a little sad, and it looks like they're offloading a few things to try to get back in order. So bummer.
Yeah, I mean, going back on that for a second, gosh, I keep seeing new like telepsychiatry startups. Wait, what is Melissa doing? Melissa's making like weird.
I can't tell if she's doing that because she uploaded our video or
I see that I see that in the chat. Melissa's doing so. You all can't see this. Anyway, my point was about telepsychiatry startups. There's still so many of them, and like, I don't know, man, that's a rough space. There are so many licensing rules from state to state. There are potentially like safety concerns. There's questionable issues about like whether the DEA is going to continue to allow, prescribing of controlled substances and if that's even safe, right? There's just so many issues there. So I don't know. I can't necessarily blame Amwell for this because it is probably also a complicated asset.
Yeah, well, I also think like in general, telehealth companies like just kind of it took a big hit, right? They had the situation of the pandemic, right? We saw. I mean, like think about Teledocs. Totally has been struggling for a bit. A company, like some of these companies that they acquired, just like really kind of screwed. I can't blame it all on that, but like right, Teladoc bought Livongo, and then Glenn Tillman made out, and then he made Transparent, and now he's buying other distressed assets. But a lot of these things were like really overvalued. telehealth was like going crazy, and then like the world opened up and people started going back to doctors again, and also like policies changed, right? So I don't know. A lot of it is like,
well, that I think that was Sergey's point from the previous slide. He's like, take your Livongo money if you're looking for a place to put it.
I mean,
I'm glad lose your Livongo money.
I'm glad that someone made out there, and it definitely was Glenn Tolman. So that guy is good at making money. I will say that. Oh, so big news with Blue Shield of California.
Oh, yeah. So, yeah, congratulations to Lois Quam, the new CEO, the first woman in 86 years, because women have only recently been able to have jobs like CEO.
Yeah.
It's a new thing. It's a new thing they allow us. First, they were like, you can have your own credit card, your own bank account, and then 50 years later, you can be a CEO. So it's going
That's what I'm talking about.
That's right. That's right. You can. They're like, maybe.
I mean,
but
we aren't
it's not straightforward.
our own uteruses anymore, but we can be we can be CEOs sometimes. It looks like
a few steps forward, a few steps back. You know, it's gonna be fine. It's gonna be fine.
Yeah.
Oh man, this is quite the change, though. I mean, this is like the things that happened at Blue Shield are a pattern now that we are seeing with a lot of these nonprofit health plans, and they made a bunch of changes. Do you have other slides about this or no? Just Lois.
No. Okay.
But I have to make fun of the names. I have to make fun of the names. They did a reorg, and the names are hilarious.
What are the names?
Okay, so Blue Shield of California created a parent company, like a holding company, and the name of that company is, get ready for it, Ascendian.
You sent me a bunch of signals about someone who misspelled their name 17 times. That's what
this is why I'm laughing. So they created a holding company, and the holding company again is named Ascendian. A friend of the show, Emily Peters, was like, that name is not meant to be shared. It is meant to be a forget about us, like never think of us again. We are a secret, quiet holding company. So Ascendian is the holding company, then Blue Shield of California, and then they have the Blue Shield Promise Health Plan. Those are all still subsidiary companies. That's what Lois Quam is the CEO of, is Blue Shield of California and Blue Shield Promise. And then they also have a pharmacy, like a benefits management organization, like a health services organization with other weird names like Stellaris. So they did a whole thing. Paul Markovich is in charge of the entire group now. So it's like a promotion, but also not like a promotion. Paul Markovich
got super promoted, and then they made Lois the woman CEO of the. So she got promoted, but actually is not the big CEO. Got it.
She isn't.
That sounds right, because women were not good at doing a lot of stuff. So I'm just delighted that anything's happening here. So that's fantastic. Speaking of stupid names, so they named it something confusing and forgetful, so that no one would think about it. I'm totally here for that.
Like Elevance, Ascendian and Elevance are in the same family of like weird made up words that are like, for the holding company, don't worry about it.
Yeah. Okay. Do you think Hatco was ever supposed to be a name anyone cared about?
Ooh, yeah, Hatco. I feel like Hatco is the same vibe.
Yeah, same
Alphabet,
vibe. Also,
Alphabet, Hatco. What else? People in the comments, just let us know the other like ridiculous made up holding company names. Hatco, Ascendian, Elevance.
Yeah.
Alphabet.
Also, like, warning, when you come up with a name like Insena, just make sure it doesn't autocorrect to insane, like ours does. So
what could go wrong?
What could go wrong? La, la, la.
Nothing.
All right. Lisa, you're so just a reminder, Hippocratic AI won biggest AI scam in the health tech talk show's best and worst of everything. And this week they raised $141 million in their B round. So
I think they owe me a thank you, because we dubbed them the biggest AI scam, and then they raised $141 million. Obviously, we are the only people who think that, because clearly their big, huge bucket of money is going to soothe any hurt feelings, and they're going to be fine.
Yeah. So this guy, he started, what was the other company he started, Lisa? That was like a total bomb?
Health IQ. And I was also informed that the previous name of Hippocratic AI was Health GPT.
Oh shit. All right. Okay. I mean, yeah. So this is a little bit like the Forward Health CEO. What was his name? I don't remember
that dude's name.
but
Yeah.
Forward Health tanked also, and then there was, I guess he was tweeting or LinkedIning or something about how everybody called him and said they'd give him more money for something else. Lisa, I would just say I'm so looking forward to being reincarnated as a man in my next life.
Yeah.
So nice. I too can continue to fail up. I'm ready.
Yeah. I think anyway, the problem with Health IQ was that they raised a good amount of money, and then they started to have financial problems, and they didn't pay their vendors, and they had a class action lawsuit from their employees and all kinds of things, and then just really rolled that almost immediately into a new company. And so I think, people generally don't feel great about that. And but at the same time, clearly the repercussions are zero.
Yeah. And so Lisa, remind us again why you dislike Hippocratic AI.
Because I think it is the lowest thing we should be focusing on right now, creating quote unquote AI clinicians. I don't think that is, the direction we need to go in terms of how we're going to use advanced analytics and machine learning and LLMs in healthcare. I think we should be talking about how we actually fix really complex back office problems that have stopped interoperability, that have made this massive administrative burden. We should be talking about how we can truly empower and connect more people, more patients to human clinicians, human physicians for care. I think taking the humanity out of healthcare is just incredibly disingenuous and a crummy way to proceed. It's not going to get us where we need to go. And that's what this is about. They're saying that they're creating AI nurses, that they're going to, you can pay your AI nurse $6 a day versus whatever, and you're going to solve all these problems. I just find it to be the most disingenuous and crummy use of millions and millions of dollars and talent. We can do so much more. Care is human. Sorry, y'all. I just really believe that.
I mean, that is what's a little wild. You can pay your AI nurse $6 a day and avoid paying your actual nurses stuff. So this is the thing. This is venture capital, right? They are there to make more money.
That's
and
right.
I freaking appreciate, as an LP in a venture capital fund, I appreciate that. I would like to make money too. So it's not venture capital's job to go out and solve our nurse supply issue and the undervalue of our nurses and all that. That's not their job. But it also just highlights this societal issue where instead of actually trying to pay people more money and improve working conditions,
we're going to spend our money on
pay for childcare, whatever it is. We're going to be you know what we can do? We can save some money with the AI. So no shit on venture capital. I get that's your job, is to make money on things like this. Yeah. And by the way, increasing salaries of nurses and getting more in the workforce is not going to make you any money as a venture capitalist, but it still is kind of a sad thing.
But there's so much that needs to be done in health tech in this area, right? There's so much work you could do, so many cool things you could build. Maybe not as sexy as creating, I don't know, an AI clinician or whatever. Exactly, Rochelle. But there's so much work to do. There's so much we could cut out and make automatic, and using agentic AI, for example, to speed the exchange of data, to improve what kind of data clinicians are actually looking at and using when they're delivering care, getting rid of a ton of back office stuff that's just really, really hard to do. There's so much stuff to do. And it's easy, quote unquote, to specially train particular AI chatbots on a particular corpus of health data and be look, I created a clinician for this. It's not easy to get that data into the EHR in a meaningful way and make it easy to understand and use and actually connect data together. You're just going to create something that sits on its own and does very little. And that's the hard part, man. And you know what? It's not sexy. It's not fun. And nobody's funding it at $141 million.
That is true.
But somebody is funding Innovacer.
Speaking of people throwing even more money around, more venture capitalists. Woo! So there's a great tweet that I have in here later about this. So I used to know what Innovacer did. And I actually no longer know what Innovacer does, because I'm like, how do they need this much money to do what I thought they did, which was like integration shit? So clearly they do other stuff, but congratulations. I think this is their D round, I think. I actually don't remember. But they were one of these companies too, like huge valuation during the pandemic. Things kind of went down a little bit, or it's at least the same. Things haven't really grown, just the way the market went. And now they raised a shit ton more money. So congratulations, Innovacer. We're here for it. We got another slide later, but and then speaking of more people putting more money in funds that will make money, Eli Lilly is teaming with Andreessen Horowitz on a new fund to spend all of their money and make more money. So like, oh my God. See, this is what we were talking about with the Trump administration. It's like, like we might not be able to control our uteruses or anything, but everybody's probably going to make a lot of money for the next 4 years. And I feel like all these rich people are gearing up to make that happen.
Yeah. And especially Eli Lilly, I'm sure you're going to love the weight loss drugs that they create with Andreessen Horowitz's money. You're going to love it, Kat. You're going to love that they're going to be pushing those weight loss drugs.
If I'm not going to be a rich person, at least I will have rich person joke content on the talk show for the next 4 years.
There you go.
Yeah. By the way, the talk show has been going on for almost 18 months, just in case anyone cares.
Wow.
Who knew that we would make it this long? That's what I'm talking about. So anyway, I hope all of our friend health tech companies enjoy pitching this new fund. This was the great thing that I don't know if it was about Innovacer, but I think it was about Innovacer. So another great X post from Nikhil, top shit poster 2024. If someone ever put a gun to my head and told me how to explain, or told me to explain what any healthcare startup does that's raised more than 200 million, tell my family I love them. Same.
It's a lot of money. It's a lot of money. They are hiring. They are growing. David Nace, Dr. Nace is sticking it out there still, and they brought in some new people recently as well. So all good. Oh, yes, Justin.
Also, can we just say Justin? I'm not talking crap, but
I know you gotta read it in his accent. We're not gonna do that to you, but we love you, Justin.
Justin's in Arkansas. Justin, I am also having a snow day, by the way, down here in Georgia. It's beautiful. But yeah, like samesies, agree. These things have to actually work also. But read this with a great Southern accent.
That's right.
All right. What are we doing here? Is this my last one? Oh, that's good, because our special guest showed up, we just forgot where he's from, and he is from the LA region. So it turns out,
JAMEY,
we should be kind when we're like,
where is that guy? He is evacuating his home. Is everything okay, JAMEY? Give us the update.
Congratulations on 18 months, guys. That's like an amazing feat of strength. Festivus for the rest of us. Like, job well done. I'm currently evacuated. And there's just so much news coming at me so fast about what's happening in the community. I live in Santa Monica. I'm in a mandatory evacuation zone. Our neighborhood is currently still standing. But I have so many friends who have lost their homes. And we had this moment with me and my wife where we were like looking around the house, and you spend your life accumulating things, right? And we looked around the house and we're like, what do we want to take with us? And it was just like our pictures, our legal documents, and our kids and our dogs. And so we are holed up in a hotel in Orange County with our pets. My little puppy's looking at me right now. Just thankful and feeling blessed that we can do, that we're getting through this, and the future is still undetermined. The Palisades fire is still only 8% contained. But we're just living kind of one day at a time, and it really puts things in perspective. And I don't know about you guys, but we've seen so much tragedy on TV, and I feel like TV really desensitizes us from some of these things. And now I'm living through it. All of a sudden, not that I didn't have empathy before for people that were living through what happened in Nashville with the floods, or anything like that with, Hurricane Sandy or whatever it is. But when you're living it, it is a completely different beast. And I feel like all of us just need to have a lot more empathy and compassion, and not feel like we're watching, a Bruce Willis movie on TV when we see these things. It's a next level emotional roller coaster.
Yeah. Yeah, I'm really glad you guys are okay, that you are physically in a safe place. And you know, I also have, you know, friends, really close friends who were evacuated from Pasadena. And you know, we're just watching the news and thinking about it. And you know, I live in Northern California, in a place that in other years has had similar fate, and you know, it's really scary to watch, and so many people affected. The thing that I feel, and I don't know, Jamie, how this is landing for you, but I just think, doesn't it feel, it seems to me like people have this inherent desire to help. Like if you get through all the BS, like there's just like, people want to help, like they want to help each other in person. Of course, there's going to be one or two random people who are doing something bad, but most people are like, just have a deep like sense of how can I help? What can I do? And like, you know, whatever. That's what I've seen so far.
I think humanity is at its best when something like this happens.
Yeah.
It is unfortunate to me that we all kind of regress back into our routines eventually. I'm a huge believer in like kindness and empathy and all those different types of things. And I feel like over the last few years, like we as a society have lost those things. Like, where are they? We've been building fences instead of bridges. You know, social media tends to spurn a lot of hate, right? And people like not talking to someone face to face, even like we are now. And so you put in a tweet or you put a post on Facebook or whatever it is, and you're like, I'm entitled to my opinion. I'm going to put it out there. And you don't realize the repercussions that may have. And I think that's the bad side of humanity, right? Like the, hey, I want to say something really obnoxious to get a like. But the reality of it is, yeah, I mean, this is what rallies us all together, and it's the best of the human spirit. And you guys were talking before, Lisa, earlier on the show, because I got here, and by the way, I was super like, oh my God, I've been waiting for this opportunity to be with Kat and Lisa since the last JP Morgan healthcare conference. We had lunch.
We would have rescheduled. By the way,
would have rescheduled you.
I'm not missing
Absolutely.
it. You guys are a welcome distraction from what's going on as far as I'm concerned. And I'm like, oh my God, I can't believe what time is it? And I hopped on and I was listening to you talk about AI, kind of some of the AI washing that's happening, as well as the concept of like what the good uses of AI actually are. And it really hit me when you talked about, you know, the humanization of healthcare, because in my last role, when I was, you know, co-founded Cloudbreak, like our slogan was humanize healthcare. And we were talking about humanizing healthcare before people were talking about humanizing healthcare, despite the fact the healthcare industry has been around for as long as it has been. It feels like it's become about the technology instead of becoming more about the people. And that's been like such a dangerous trend. So seeing, you know, living through this now and seeing people be nice to each other and offering support and being there for other people is really palpable, because I feel like where society has moved to in the last, you know, 8 years has been tragic, right? Undermining of all our governmental institutions, undermining truth and integrity. And those things are just so important and so fundamental. And it's taken me candidly a lot of therapy to like rationalize the world we live in today, right? So, you know, for me, like this is goodness. So happy to be here with you guys talking about these topics.
That's really awesome. I mean, like, I think you said it. You just said it a moment ago, right? It's this AI washing. When you make this stuff about the particular kind of technology or the thing, in the case of AI, like an advanced analytics tool, as far as I'm concerned, you're like missing the why are we doing this? Like, what are we doing this for? Hopefully we're doing it to improve patients' care, number one, like make delivering care less crummy for clinicians and physicians and staff, like to not waste money on things that aren't valuable. Like you got to get down to what it is. I mean, that's where I keep getting stuck. It's like, I don't care. Why are we, I don't like, you're using the Anthropic LLM or using the ChatGPT. I don't care. I don't care. I care about the outcome.
Lisa, totally. To your point, right? I think, and this goes back to like Simon Sinek, too many people talk about what they're doing and not why they're doing it. And, you know, just to throw some love Kat's way, I don't know if Kat, you were responsible for the Collective Medical website.
I was responsible for everything.
Back in the day.
Well, then I'm going to throw even more love your way, because when I modeled our Karen's website and some of the websites that I built lately, I've been modeling them after the Collective Medical old website, not the Point Click Care one. Because
with the people use cases.
Yes, because
Like
one of the things
yeah.
that you guys nailed was your why.
Nice.
Like, we are here to solve the opioid crisis. We are here to improve mental health. We are here to do these things. And
Oh,
that
yeah.
storytelling is so fundamental to solving the problem. And it was so well done that you and Chris deserve, you know, a lot of credit for
or
you
me.
know.
Do you hear that, Chris Club? Everybody loves my website, even though you did it. And now, I bet you now he's going to tell you that he always.
By the way, Kat, it wasn't like easy for me to find. I had to go back into like Time Machine or whatever they call that thing on the internet to go find an earlier iteration of the website.
Point Click Care. God bless Point Click Care, by the way, great company, but they did, you know, put our website into the storage.
Yeah.
That's fine.
Yeah.
You know, they paid for it, so it's cool. They can do whatever they want.
they hit the archive button, but it was so well done. And I think, you know, to Lisa, your point, we don't spend enough time talking about our why. We spend too much time being like, we're an AI company that does blank, blank, and blank, but that's not really it. Like, we're here to help patients, help providers, you know. And when I was at Cloudbreak, everyone was talking about being patient centric, which I think is wonderful, but we were talking about being like human centric. And that meant including the providers in the discussion and the clinicians. I know people sometimes don't like the word provider, clinical teams in the discussion, because, man, we have this huge clinical team shortage. We're always asking them to do more with less. We're throwing new technology at them that no one ever did any UI, UX design for, so it makes their lives harder, not easier. And as, you know, citizens of the United States, we kind of take our healthcare for granted. Like, so we treat them like a consumable instead of someone who's spent, you know, 4 years going through medical school, another few years doing residency, another few years doing a fellowship, and who got into medicine hopefully for the right reason, right? So our whole goal was to like restore the joy of calling back to healthcare, because our theory was if we can improve a doctor's life, he's going to take better care of that patient. So like, what's the downstream effects of that?
Yeah. Yeah. So, you know, Jamie, question for you ahead of JPM about AI. So on our last talk show, and I think Lisa and I always talk about the things we like about AI is it could be used to really like just handle a lot of back office bullshit. So clinicians, providers can do what they actually want to do, right? Reduce all this pajama time, actually focus on patients. And you know, we make fun of a lot of the other stuff like the AI nurses, but is there something that like you think is going to blow us away in 2025 that's enabled by AI that like no one's talking about? Like, what's going to be the and it's going to make everybody's 2025 recaps in December. Like, what does that look like?
I mean, I'm kind of hoping, Kat, that for all intents and purposes, we're not blown away. In other words, like that the AI kind of melts into the background and that it becomes part of like the ether, and it's enabling us to do things that we didn't think of, and doctors to spend more time with us and care to improve, but like we're not seeing it. I think it's a problem when we see it. Because that means that we've done something wrong UI, UX wise, in my view, that like, you know, we shouldn't be able to see it. It should be completely invisible to us and what's happening behind the scenes, but we should feel like we've become not data points, but, you know, people are now listening to us as a story. Like, one of the things that we used to talk about a lot is that, man, you know, when our previous company brought language interpreters to plan of care for limited English proficient deaf and hard of hearing patients. And at the core, you could be like, oh, we're a language services company. But when we looked at it, we're like, no, we're a health equity business. We are helping level the playing field for people that can't do it for themselves. And the communication was so fundamental to the provider encounter, the clinician, the doctor and physician encounter, and people were like ignoring it, right? Like, that communication wasn't considered important. It's like, no, fill out this form instead. But when you take a look at a physician chart, what is it? It's the history of present illness. It's your family history. Everything on an HCAP survey, like 70% of the questions are all related to, did the nurse explain this, this, and this to you? And so that story that we tell doctors is how they make a differential diagnosis. And if we cease being able to tell that story in a really cohesive way, and the AI misses something, or, you know, the doctor's not thinking about it, that presents a real problem. And so for me, it's about using the technology to restore the human connection to what Lisa had said before. Like, that's the purpose. That's the point. It's not to intermediate it. It's to restore it.
Yeah. Like I desperately want my physician and any other providers and clinicians, I want them to be able to focus on the actual human care part of it. I do not want them to spend pajama time charting. I don't want any of that for them. I don't want them to have to, not just that, the pajama time charting is only one tiny piece of it. There's also the hours and hours that physicians are now spending on the phone arguing with insurance companies about prior authorization. That one's got to go. Like, get that out, right? Like, there's just so many things like that where it's like, what, please, let's focus on that. People will want to be doctors and go through all of that time and effort and energy, will want to be, nurses and want to be advanced practice clinicians if they know that they're going to be helping people, not arguing with a probably an AI chatbot, prior authorization chatbot. You know what I mean? Like, nobody wants to do that.
No, and the amount of money that we waste, like if you were going to build a new healthcare system today with all the resources the United States has, it would not look anything like the current one that we have, right? And I think like our healthcare system, like the financial system, has almost become like too big to fail, and there's too much revenue at stake. And so we're making really poor decisions. And the fact is, you could probably cut $1 trillion off, so
easily.
Healthcare is 4.3 trillion of GDP, right? Currently and growing. We never thought it would grow the way it has, but it's growing. And it's 20% of spend in this country. And most like $1 trillion of dollars that has to be spent on. Can I swear on the program? Is that cool?
Oh, absolutely.
Cool?
Yes.
Maybe you haven't watched it this much.
Fuck yeah.
It's like bullshit administrative costs that are completely unnecessary. I went to the doctor the other day, and to think about like the fact that clinicians are still using fax machines is like mind blowing to me. And I went to the doctor the other day, and they handed me my MRI on a CD-ROM.
Nice.
Yeah.
Love it.
So I was talking to John Elwell yesterday. He's the CEO of No2. No2 does interoperability stuff. They're pretty great. We like them a lot. Big fans. He was telling me yesterday, I can't remember the exact number, but 72% or 78% of all healthcare data transactions are still fax. And on average, it's 14 cents per transaction, which, by the way, is a lot. And I was like, really? Because like so much of what we do in health tech is we're working with companies that don't do that, right? So he's like, no, like we still have to facilitate that because that's what people want, right? That's what people are still doing. So totally wild, It's interesting to like, once you get out of your health tech land where everything is magical and amazing, and we have AI nurses walking around and doing stuff that like that's usually not how the real world works.
Right. Yeah. It's been so like for me, like when we talk about AI, like it's like, what are the practical uses of AI? Like I'm all about practical AI. I'm not about the impractical AI right now. And I think there's a ton of good uses to streamline, revenue cycle and to be agents behind the scenes that help clinical decision support for physicians. Like I love those types of use cases. I love kind of what we're working on at Cairns from the standpoint of like helping seniors navigate what is a very complex care for them and other polychronic patients. Like that's the area where we could be like really helpful. But what we should not be doing is thinking replacement or intermediation. Like it should be all about building more human connection.
Yeah.
Definitely.
So with the humanizing healthcare, right?
Yeah.
So this is like a big ask in the 18 minutes left we have on the show. But how would
bring it?
So let's say you just like knocked like we're saying we're just going to rebuild U.S. healthcare,
bulldoze it,
scratch, with the goal of humanizing healthcare. Assuming that's like that would make it better. I believe it would. Like, how would you do that?
I think people need to be like, everyone talks about like utilization, right? And I think there's a movement towards trying to get people to utilize the system less. I would actually argue that we need to be utilizing it more, and that better utilization of our healthcare system, especially primary care. Like, oh man, if we could actually call our doctors and they were available for us when they needed to be because they weren't seeing too many patients, but they were like being compensated appropriately for the gateway to the healthcare system. I just saw Justin's axe the facts. We were using on Twitter for a while WTF, but it was what the facts, right? So we appreciated that. But I think it's about, us spending money in the right places and allocating in the right places where like we feel like we have a care coach. And everybody wants to have the person in the family who's like the doctor. So they're like, oh, I spoke to my doctor today and he said I have this. And you go to that person and they're like, well, actually, you should be asking him this question and this question. And it's about doing things like that that can help make us more informed consumers of our own care. Because I think right now, the system's too complex. Most people don't understand discharge instructions, as an example, when they get them. And therefore, they aren't care plan adherent and they end up back in the facility and they simply didn't know or didn't have proper guidance and didn't have proper support. So if I'm architecting the healthcare system of the future, I'm thinking about it more like a sports team, right? And I'm a patient as a player or a player coach, and I've got a physician, a care navigator, someone who can advise me financially on what I should be doing, which is the right plan for me. I've got good transparency on where I am at any time on my deductible. Like if you ask people across the United States, like, hey, where are you on your deductible? 90% don't know, right? And so it's impossible to be a good consumer of care, and there's no pricing transparency, which is a huge contributor to the problem too. So I think you make the system more human by enabling the humans to be better consumers of their own care and make better, more informed decisions about, excuse me, their lifestyle, how they live their life, what they eat, all those different things, social determinants of health that lead to, you know, better outcomes and better support in the community. I mean, I sit on the board of the American Heart Association, and I got involved with the American Heart Association because I was pretty amazed with the work they were doing around social determinants of health, building gardens in inner cities, right? So that people could have access to produce and those types of things, and realizing that we have food and medical deserts in some of our nation's most prosperous cities. Like we have them here in Los Angeles. It's really going to rear its head for us over the course of the next few months as we recover from what's happening right now. But like, that's why MLK Hospital exists in Watts, right? And in Inglewood, because that community deserved to have good healthcare. And the only way to do that was to get the county to fund the whole thing. So, you know, those are the types of things that I think we should be thinking about. And again, it's more about humanizing healthcare than it is about any type of technology. Like the technology in healthcare, not super exciting if you ask me. It's about what we do with the technology and how we apply it that's exciting. It's things like Risant Healthcare happening, right? Like the concept of Kaiser taking their integrated community model and really what is a value-based care model and putting it into the community, like where it's not a closed system, like that's exciting to me, right? Like let's come up with new care models, and then the technology will move to support the new care models. But we've been talking about value-based care for 30 years. Like how come it's not farther away?
Because these are really, so, you know, before you do anything with technology, you have to do this highly collaborative effort with communities to map out how you're going to do this and what you're going to cut along the way in like red tape and processes that don't suit you anymore. That's really hard work. It's not easy. It's not building an app, right? It's literally
it's
collaborative. It's super collaborative and difficult and time consuming community work that requires you to use communications and advocacy skills to get people to, you know, share a vision, to find a shared vision, bring people along, narrow down, don't get distracted, fight through the red tape. Like these are not technical skills. Those are like communication skills.
Yeah. Some of the most amazing community health efforts I've seen. By community health, I don't mean community health. I mean communities that are healthy or have massively improved. It's always like really passionate people on the ground who are doing stuff. And like, that's always
like super connectors who are super connectors, who are like these incredibly connected people.
Yeah, we talk a lot about our friends in Huntington, West Virginia, and the amazing work they're doing with opioids. And I always think, and there's a lot of communities like that, right? We see them all over, and I should shout some of them out, and we should have them on a later show. But I always wonder, like, okay, like this is a pattern, right? We find these people, the way they do things is different, but they're always super passionate, engaged, like these champions for healthcare and communities. How do you replicate that? Like, it certainly is not technology.
So we used to talk a lot about like, who are the people that are going to change the face of healthcare, and like how come Silicon Valley hasn't been successful in really changing the face of healthcare, right? They've changed retail, they've changed financial services, like why not
change money?
Right. I think that healthcare is one of these industries that changes from the inside out, and from people having really fundamental experiences with the system that have disappointed them. And at Startup Health, we always talk about problem founder fit as opposed to product market fit. So you find these founders that have had a fundamental experience that really drives them to want to change the system and how it operates. And it's obviously much easier to do in some of these smaller communities than it is to do it in big cities with these really entrenched players. And I think that's the driver of it. A lot of it is about, you know, how you, it's about replicating the people. It's about, can we build constituents of people who want to be those game changers in their respective communities? Because at the end of the day, as much as, you know, the United States is a huge national, you know, political organization and country, healthcare is local. And you can't convince me any other way that healthcare is not a local business, and then it doesn't start house by house, hospital by hospital, and city by city, community by community. It's like, I'm convinced that that's where the change needs to come from. It needs to happen at the grassroots level.
Yeah, this is Jamie, you are actually giving a lot of really great talking points from my organization, Civitas Networks for Health. Feels like you were reading our all of our messaging, because we say like healthcare is local, community by community. You have to build and maintain and strengthen and feed the local infrastructure to get anything done. And importantly, like how you implement stuff matters. And I feel like it's just so tempting to be like, from the federal government's perspective, be like one solution for the entire country, one network for the entire country, or like one technology platform. And that's just not necessarily true. There are opportunities for like technology innovators and for technology to have a role, but it's not you don't just like, I made the app available in your region, goodbye.
When are we going to start just playing nicely in the sandbox, right? With each other, and realize that, anything that has ever happened in my life that's been great, I've done with other people. It's been people like locking arms against a problem, right? And by the way, Lisa, I did not research anything before this.
No, don't worry. We didn't never do.
Zero
we
research.
Know what you do. That's it.
This is just what I believe.
No, I know. It's beautiful. I love it.
So, and I remember like, early in my medical career meeting like Z-Dog MD and Z-Dog Zubin kind of came and said, it's going to be a pretty great day when the healthcare system is built around what it can do for people as opposed to what it can do to people, right? Like a whole revenue model of healthcare is built around fee for service and what we do to people. But when we finally get around to doing like what we can do for people, it's going to be magic. And, to your point, like it starts with us. And I think that's the thing that people don't realize. It really hit me hard. And I'm sure this is controversial. Seeing the CEO of United get shot and seeing everyone's reaction to it, and seeing that people were like, as opposed to being like, oh my God, this family lost, their father and a person in their community. It was, well, that happened because people hate their insurance company. Like, okay. Is that the solution?
Murder is bad.
Like, so that hit me really hard. And, I went to the web just, and I posted something on LinkedIn. I'm like, man, it's like, this starts with us. Like it starts with Kat, it starts with Lisa, it starts with Jamie, it starts with our families, it starts with our kids and our perspective on how we treat each other. And we just, this is going to sound hokey and cliche, but like, man, it just needs to be more love. More love.
Yeah. I think, I mean, it's so sad for that person, Brian Thompson, and his family, because he got caught up in something. I mean, in the reaction to this person's murder was terrible. And
it was awful.
It had nothing, of course, it had nothing really to do, his specific murder had nothing to do with this bigger story. I do think that it's really interesting, and, what the timing question, whatever, that the board members of United Health Group are now saying, like, hey, we are we are a mission-driven organization. Like, there are all of these comments and all of this feedback about, are we making decisions that benefit people, or are we making decisions that benefit our share price? And so if something good comes out of it, that there is a real focus of saying, like, as healthcare companies, as mission-driven companies, whether nonprofit or for-profit, are we doing what you just said, Jamie? Are we looking in the mirror at what we're doing and saying, are we doing something good and something for benefit? And people who know Brian Thompson, spoke really highly of him as a person, as a family man. And you can only imagine that, some outcome of, better focus on delivering healthcare to people will be, good for his memory, right? But it's not, his death wasn't related to that. His death was an unhinged person murdering someone in broad daylight. That's different.
And that goes to kind of the sense of entitlement to care. And it goes to the fact that, by the way, anyone who's chosen a career in healthcare, like, we're nuts, right? Like, it's not easy.
Right.
Like, there are easier places to go out and make a life.
For sure.
Than in the healthcare industry. And, I think, man, it's so hard to build an understanding between patients and doctors over what that looks like. Like, when I was at Cloudbreak, there was always this use case where it's like, hey, if I told you, you're in your doctor's office, you're sitting there waiting for 20 minutes, and all you're sitting there thinking is like, man, they're really not respecting you. But if you're able to take a step back and think about the fact that maybe that doctor is giving a terminal diagnosis to a cancer patient, and they are just, would you not give up freely your time to be like, yes, you should absolutely spending time with that patient, answering their questions. Like,
absolutely.
Where's the understanding and the empathy? Why are we so focused on ourselves, right? So that to me is just a broader societal question, and I don't know how to fix that.
Yeah, that is really tricky. I do wonder too, like if a lot of we just have a lack of connection in general in society right now. Like people don't hang out in person. They don't talk to each other. They're
it's
not
like pseudo
listening.
connection.
Yeah, I mean we got the Instagram and TikTok. Well, I guess soon we won't have TikTok. I don't know what happened. I wasn't following the news today, but yeah,
they're gonna leave. The TikTok's parent company is saying they are still gonna pull out if they're forced to sell. They are that uninterested in any solution with the US. So hopefully that lets people understand where their priorities are. That's all I'm going to say on that one.
Yeah. Well, I mean, I guess they're not interested in swimming with us in the Gulf of America or buying Greenland or taking it. I don't know. I mean, all right.
By the way, I just want to let you know, Kat, I got my Canadian citizenship back.
Nice.
Well, Lisa.
But I guess I'll still be able to travel under an American passport. I'm just saying.
You'll be fine. You'll be fine.
I mean, being the 41st or 51st state probably isn't so bad. I think, I don't know, maybe Greenland will beat you to it.
Do people understand that Canada has provinces? It's not just one big country with no other. Just
America,
curious.
Lisa?
Just curious.
And the predominant language in some of those provinces is French.
Awesome. Do we want to take over all of Panama or just the canal?
That's a good question.
I'm gonna stop. Okay, Jamie, listen, we got a few minutes left. So we're going to JPM next week. You know a lot of startups. You I believe still work with Startup Health. You've been in a lot of startups. You sold a startup. Like what, tell us what advice you would give to startup leaders going to JPM the first time.
Yeah, so
or not, or their fifth time. It doesn't matter. It's always crazy.
Yeah, so look, I love going to conferences because I get to see my conference family. So as much as I'm going for investor meetings and as much as I'm going for, to meet new companies, I'm going to see the people that I don't get to normally see. I loved having lunch with you guys last year.
Yeah.
I love being in person to the point where during COVID, I went to the office every day, although I guess I was alone there too because no one else came in. But, I think if you're going to JP Morgan, it's an interesting beast. And by the way, I don't understand why the conference is still in San Francisco. I don't get it. I don't understand why they don't make it easier for everybody to meet because 90% of the activity happens outside the conference.
It's incredible.
When you're paying $1,200 for a Motel 6, it's a little bit of awesome, Michael. I'm glad.
Michael, he's there with you.
Yeah,
he's just taking. He's packing his lunch every day, going to work, just like you.
There it is.
That's right.
So for JPM, I typically will try and reach out to everybody I want to meet with in advance. There's some serendipity there that happens at the evening receptions, but it's really about filling up your schedule and going from meeting to meeting to meeting. And it is a intense conference from that standpoint because you're going from one investor to another investor. It might be cross town. It might be in the same place. There's a really cool law firm that had set up an opportunity for founders to be the center of the action, and they actually let you get a table at the Cavalier restaurant just kind of off of Union Square. And so that's what we did for the last year or two, and that was really helpful because then people came to us as opposed to having to go to around other people. But for me, it's be open and put on athletic shoes. Don't worry about dressing up. It's about it's speed dating, and reach out to people in advance. And in LinkedIn, one of the things I found really effective in terms of generating meetings is when you reach out, be looking forward to seeing you at JPM, and then generating the meeting in that way. And it's been really effective. But every time I go, I'm literally back to back from 8 o'clock in the morning till 5 o'clock at night in meetings. And then there's 3 different receptions to go to. And, I just try and make the best of it every single time. And every single time I've had great meetings, and never have I ever, gone to the JP Morgan Healthcare Conference. Maybe once I had a pass. It's, and by the way, bring multiple umbrellas.
Yeah, you'll need them.
Right.
It's probably it doesn't say it's gonna rain, but that's never a promise. We definitely always have interesting weather. I will also say, for those of you who are not from Northern California, we did have 3 earthquakes today. They were small. I did feel one of them. It's probably going to be fine. Don't worry about it too much. But earthquake safety, if you are outside, stay outside. If you're inside, stay inside, ideally under a door frame or something, or get underneath something, duck and cover. We had to do that as kids.
Lisa, it's a good thing I'll be with you.
That's right. They did make us do the duck and cover sort of drills in school here. So yeah, we have earthquakes. Sorry, there's literally
as great as it is to live in the state of California, we do have our problems for sure.
That's right. That's right.
For sure. We're gonna have to hold hands.
I was speaking to my partner today, and I'm like, look, with these fires that are happening, like I don't feel comfortable leaving my family to go to JP Morgan. So are we going to go fully virtual with our meetings? Just email everyone and say, we're not showing up. Like, and I've gone to this conference for the last 15 years.
Yeah.
So, we're wrestling with those types of things because again, I really miss being in person. So I'm going to miss hanging out with you guys if I don't go, but
well, we hope to see you, but I feel like you've got a reason. So yeah.
At the same time, like, this is a really truly unprecedented disaster. It's not, and it's a serious, it's not going to be better overnight. And the scale of it is not something that people outside of LA or California can understand right now. And so, just be really thoughtful, everybody. Be really kind to your colleagues and your friends and your family in the area. It is a huge displacement of people and destruction of property and some deaths. Luckily, it looks like, fingers crossed, is a relatively small death toll, but huge disaster. So,
it's actually pretty amazing given the level of destruction, how few casualties there have been. And it's, incredibly sad. We've lost some firefighters. I understand that some people may not have gotten out of their homes, which is tragic. But considering that, a few thousand structures burned, and like I saw a video, there was a drone flying over Pacific Palisades. It's like a nuclear bomb went off.
Yeah.
It is leveled. So it's kind of amazing that, I'm sure we're going to have some numbers rising as people, start doing the math, but it's kind of amazing that there hasn't been more from a casualty standpoint. And again, we're just blessed. Like, people were walking the streets are blessed, and we understand that our possessions are just possessions and that's it. And we will rebuild.
Yeah. Well, I'll say too, I talked to a LA-based investor yesterday or the day before, and he was like, I know you're seeing it now in the news, but it's still being underreported.
You don't understand.
It is so tragic. But I'll say this, I know that in the past, when a lot of times people don't know what to do in cases like this. So Jamie, it would be awesome, and you don't have to do it now. You can text us or email us later, and we'll include it in our recap tomorrow. Like, what would you suggest our millions of fans, because there are that many, what would you suggest they do to help? Because everybody wants to help, right? Most people just don't know exactly how to help. So if you can give us some guidance, we will post it and rah the crap out of it.
I could definitely do that. I did sit on the board of the American Red Cross here in LA for 10 years. So I'm in touch with the CEO, and we can definitely provide some guidance. I know that, the LA Fire Department has a foundation that is, doing a lot of work behind the scenes to, one, support the firefighters, but two, support those who lost their homes. The American Red Cross is absolutely doing that. Salvation Army, another good place to go. So I could definitely provide some links for you.
Awesome. Yeah, and I'll just add a little shout out to World Central Kitchen, who
they're doing a ton.
They're doing a ton. They're in at least 3 locations right now already. The cool thing about them is that they partner with local chefs, and they are basically setting up, temporary, sometimes semi-permanent kitchens to serve people who have been displaced. And they're in at least 3 locations right now in the LA area with local chefs. They're awesome. They're feeding people right now. They get on the ground like within less than 24 hours, and they are there. So all those people are helping, and we want to help as well.
We appreciate you guys so much. And look, the Palisades fire is only 8% contained as of now. So, and then we've learned that some of the fires are actually not wildfires. They're being started by people who are arsonists who are taking advantage of the moment. And you're like, what is the matter? Right? Like, how does that happen?
Yeah. Well, the person who started the Kenneth fire was apprehended by neighbors who were there, and a very interesting outcome there. And we don't know about the other fires yet, but I hope that they get them under control really soon. Jamie, I hope we get to see you. If we don't, we're thinking of you, and we will definitely share any information you share with us. And glad you and your family are physically safe. And hopefully things get better soon.
Yeah.
Well, guys, I've been looking forward to this for a year. I'm super grateful to both of you. I'm looking forward to seeing you guys at some point soon, especially if you're going to be coming through LA. And by the way, Kat, I think when we talked, you said you had billions of fans, not millions. So I'm.
Did I say millions and not billions? I meant billions.
Billions. She meant billions.
Yeah, I thought so.
It's been a long day. It's been a long day.
All right, love you guys. Appreciate the opportunity.
Thanks, Jamie.
Love you.
Sending
Bye,
lots of
Jamie.
love. Thanks, everybody.
All right, bye.
We'll see you.